Happy Friday, y'all. My name is Soul. I am a community health influencer as well as an art educator for The Corner, which I'm standing in right now. I hope y'all are having a great day. My pronouns are she, they. And let me pin this comment and we can get started. Hey,
Hey.
let me sit down.
All right, what are people at? Come on, people. Yes. How you doing? Hey, Shania. Thank you for joining. Thank y'all for joining. Got some people coming in. Yes. So, can you hear me okay?
Yes, I can.
All right.
Why don't we start off by introducing ourselves? You can go first.
All right. My name is Christian Morris. I use he, him pronouns. I'm from New Orleans, Louisiana. I work at Whitman-Walker. Yep. What else should we do for introductions?
What's your title at Whitman-Walker?
I am the community engagement specialist or the recruitment and retention specialist for the research department in Whitman-Walker. So I help talk to the people, to the community, and to the researchers and to the doctors, basically.
Thanks for joining me today. For those for those of y'all who don't know, my name is Sol. I am one of the art educators here at The Corner, which is Whitman-Walker's new cultural center, and I'm also one of the community health influencers. And during the past few months, Whitman-Walker's community health department has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions. Our series of outreach sessions also focuses on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. Hey, Orlando. Welcome, everybody. Thanks for joining us. So why don't you tell us why we're here today, Chris?
Yeah. Oh, my bad. Okay, so this is actually in prep for an event that we're having tomorrow in person. Just today, just trying to let people know what goes on in the research world of LGBTQ science. How do we get, people's identities and experiences into the research world? Why does it matter? And again, this is in prep for an event that's happening tomorrow in DC at the corner at Whitman-Walker on 14th and R Street. If you're in the area, I hope you pull up. It's tomorrow at 3 o'clock. It's free, open to everybody. Yeah, hope you pull up.
Yeah, I hope to see some of y'all's faces. Chris, can you tell us a little bit about how you got involved with Whitman-Walker's research department and how your role contributes to the work around identity research?
For sure. Okay, personally, I've always wanted to work in psychology and behavioral health since I was a young person, a kid. I'm queer, I'm Black, I'm for the people, so I've always wanted my work to sort of center that. So Women Walker is an LGBT healthcare clinic. These are folks who just don't know who we are already. So they do mostly like HIV prevention, hormone therapy for, trans folks, all types of things like that. But there is a little research department. And basically, the guy who's my boss today, last year, he was like, we need a community engagement specialist in the research department, not just, at the other sites. So they created this position, basically this role, just to let the community know about what's going on in the department. Yeah. So again, my job is to communicate between the doctors, clinicians, and researchers to the people who they hope to understand and support through science.
Cool. Thanks for giving us that background. Tell us a little bit about what goes on in the research world as it relates to LGBTQ communities.
Yeah, for sure. So I would just say that our tagline in the department is research saves lives. The truth is representing our diversity through science enables us to better serve our community, both as an institution and also as a nation, truly. Yeah, not only as an individual healthcare clinic, but also broadly as a nation, and across the world, really. So as a clinic, Whitman-Walker needs to know where the needs are in our community. And to capture those needs, we have to illustrate that they exist, who it is that we're talking about, and then we can use that and we can advocate for funding and support from local, state, federal governments. But the question is just, how do we do this? How do we go about this for real?
Yeah, it seems like it's really important to have a dialogue within the community, between the community and the institution, in order for your work to really be able to progress. I know that in research, information about our communities is called sexual orientation and gender identity data and information. Can you remind me what that acronym is and why it's important?
Yeah, we call this SOGI in research, which is kind of cute. Almost sounds a little gay. Uh, that's sexual orientation and gender identity, which I appreciate because it sort of separates those out. You know, you have sexual orientation and then you have gender identity, and perhaps those are two different identities. And we need the information to get as specific as possible. So I just want to say everybody has a sexual orientation, everybody has a gender identity, not just LGBTQ people. Um, and SOGI data and information just helps us get towards capturing that and all the different types of people that there are. And just something that's interesting right now, the census doesn't ask people's sexuality or gender identity. So the largest national survey that collects all the information about everybody who lives in the country doesn't even ask if you're gay, bisexual, transgender, anything like that. So that's kind of problematic. So we can't even get real numbers about how many people we have in the US who identify.
Yeah, can you define gender identity and sexual orientation for those who might not be sure?
For sure. So gender identity, we talk about as a person's personal sense of their own gender. Gender identity can relate and be the same as someone's sex at birth, or it can be different. There's a few components to what we think of as gender most typically. So we have gender identity, which again is self-perception, assigned sex at birth. So when you're born, what does the doctor say that you are, basically? And then there's also intersex status, which I just wanted to name, bring into the conversation as well. And intersex just points to like the natural biological diversity of the human body. We're taught that there are males and females and you're either this or either that. But even on a physical chemistry, biological matter, there's actually a lot of different ways that people's bodies are born, the chromosomes and everything. So that's a little bit about gender identity. And then sexual orientation, of course, is simply I say people's patterns of dating. I think that that's a really, a palatable way of talking about it. But I also just read an interesting definition that talked about how sexual orientation has three components. You have attraction, behavior, and identity. So who you're attracted to is one thing, how sexually active you are and who you have sex with is another thing, and then how you self-identify is a whole nother thing. So, there's levels to it.
Let's get into self-identity then, and why that's important. How do you think people like? What are the categories that you think that people are self-identifying themselves in?
Yeah, and why is it so important to us? I feel like to self-identify. And
Yeah.
so when I thought about this question, I was just thinking, it's what makes us different. Self-identity is what makes us different. I think as queer people, we're born and raised being told who we are, how we're going to carry, how we're going to act, how we're going to do all of those things, and we reach a point where we have to create language for ourselves. And I think that most simply, it's a way both to protect ourselves, but also to affirm ourselves. Hey, you know what? I have a right to be here because I'm not that, I'm this. I'm not he, I'm she, I'm not this, I'm that. And so I think it's about self-empowerment, about drawing boundaries with people who try to oppress us. And I just want to say that it exists at all levels. You have the really educated queer girls and they create, all the language that makes them feel good and great. But I want to say that happens at all levels of education, which I think is so beautiful about the community for real. So, Yeah, I could even get in on that, but I know we don't have too much time.
Yeah, we don't want to give too much away today. I do want to encourage people to come tomorrow and participate in this discussion. We will be talking more about self identity. We'll have two more specialists from the Research Institute, Benjamin Brooks and Eleanor Sidorki. Sarkodie, sorry. Sarkodie. Eleanor is the manager of analytics, and Benjamin is the assistant director of policy. So we have some really educated people who will be able to give us some insight onto how research and identity work to serve the community.
Yeah,
Um,
tomorrow at 8 p.m., 14th and R Street.
yes, 1701 14th Street Northwest. Please come by. We will have social distancing in place. Masks will be required. Contact tracing. So we will be doing our best to have a safe and fun event. So come through. Do you have any final notes or tidbits you'd like to give to our viewers?
I mean, if I could just go on a tangent because this isn't really going to be an event in the event tomorrow, but I just want to, so I was hanging out. This was a couple of years ago. I was hanging out in a shelter in DC, for provides housing for people in between housing, especially for trans women in the DC area, and just hanging out a little social event, maybe playing cards and some stuff. And these two women started talking to each other, and I was like, I'm not tripping. I don't think they're talking in English. You know what I'm saying? And so I'm like, oh, are y'all Caribbean? Like, what's the accent? They were like, no, there's a language that we use when we just want to communicate between each other as trans women. You know what I'm saying? So I just think that that's really beautiful, going back to the language thing. But period. So, but again, the event tomorrow is about how do we get people and the language that they use, the language that we use to talk to each other and describe ourselves. How do we get that into the hands of the government so that we can get some money to go where it needs to go? So that's what the event is about tomorrow, and that's what the work that we do is about, really, in general. So
Yes, it's going to be really great. It's one of 36 events that we're doing here at the corner. So if you missed this one, which we don't want you to, there's definitely more ways to get involved with. I do want to remind you all that Whitman-Walker is open for free HIV STI testing by appointment at our Liz location in Northwest DC and our Max Robinson Center in Southeast DC. To make an appointment, you can call 202-797-4439. That number will be in the comments once this is posted. Social distancing is still a way to reduce the amount of COVID-19 community transmission. It deliberately increases the physical space between people to avoid spreading illnesses, especially around the holidays, especially when it's getting warmer and people want to be outside. Make sure that you are still staying at least 6 feet away from other people when possible, visiting a walk-up vaccination site or scheduling a vaccine appointment if that's something that you're interested in. Make sure that you are doing the research for yourself and staying informed to make the decisions that you need to for yourself and your family and your loved ones. Avoid places with large crowds. Encourage working from home. And stay up to date on local, state, and national guidelines for testing, quarantine, and general safety. Don't forget to wash your hands, y'all. I hope to see y'all tomorrow. For more information about what's going on at the corner, you can go to thecornerdc.com or at thecornerdc. Peace, y'all. Thanks for joining me today, Chris.
all right, see you tomorrow.
Bye.
Bye.